When I first heard of chin lipo, I thought scary. I thought maybe not for me. It's invasive. You do have to think about you're changing yourself forever. I'm Lindsey Pierce and I'm getting chin lipo done today. I'm actually in my almost mid-30s, which it's hard to hear and say that. So now when I look back in pictures when I was like early 20s, 25, I look at that Lindsey and I'm like, wow, where'd she go? I've been in beauty for about 6 years now, and I own a waxing studio. My day-to-day job, I'm actually professionally a lash artist. I'm an esthetician, but definitely looking down, focusing, so I can already feel the skin drooping. But then also because we're, on our phones as well too. With my job, I'm posting, I'm responding to emails, etc. So yeah, everything that we do is downward, so we need to lift it up. I think every single aspect of my job lifts up others, and I think that's what makes it so fun and connective, is when somebody walks in, we take care of them from start to finish, and they leave feeling like $1 million. We live with a lot of things that you don't really like and you just kind of like cope with it, but now I know that there's an option that I can change it, and so that's why I'm so happy where I can just not have to think about it anymore and just be myself.
I'm Gabbay. I'm a board-certified plastic surgeon in Beverly Hills, California. I've been a board-certified plastic surgeon and in practice for almost a decade in beautiful Beverly Hills. I focus on breast and body contouring on all sorts of patients. Chin lipo is really just trending lately because of Zoom, because of our phones, because we're constantly looking down and people are realizing there's more looseness down in the bottom of the neck than they want. And now there's a really easy solution to take care of it.
I really enjoyed working with Dr. Gabe in the past. You really do feel like you're in good hands, but that doesn't change that you're still going through a procedure, and so you really don't know what to expect. You're changing yourself forever. So there is some worry about how it's going to end up.
To start the procedure, we give our patient a nice little bit of medication to keep her comfortable. We bring her to the operating room and gently cover her eyes to keep the fluid out of there. We don't want it dripping in her eyes, and keep her face clean. I will inject a couple of areas with local anesthetic to act as access points for all of my instruments to go underneath her skin. Once I've made the access points, I will put in the numbing medicine gently underneath her skin. Once I'm sure that her skin and everything is completely numb, she's super comfortable, I put what's called the cannula, the thin, blunt metal tube underneath her skin, and I use a vibration component of the machine to get under her skin and just break everything up, loosen everything up so that we can suck out the fat perfectly. Once I've opened everything up underneath her skin, I turn on the suction on my liposuction machine and very carefully and thoroughly suck out the fat in that area. Once I'm done with the liposuction and fat removal, I put in the probe for the Refinery29 device. This is a thin metal tube, same idea, but at the tip of this device, it puts out a thin little beam of helium plasma. That beam acts as actually a little conduit or a road to allow radio frequency energy to come from the device onto the undersurface of her skin and allow and cause the skin to shrink down and contract. I do that all over the area that we talked about. I think the best candidate for this procedure is certainly someone who has a little bit of fullness under the skin. And the interesting question is, what is that fullness from? Is it from too much fat? Well, that's where liposuction comes in. Or is it from loose skin? That's where Refinery29 comes in. And then I remove the device, one last quick run of liposuction, both to remove any fat that may have been kicked up during the Refinery29 process, and then I turn the suction off, and just like at the beginning, I run the machine all underneath her skin to smooth everything out and make sure that she has a beautiful, natural, smooth contour without any lumps, bumps, irregularities, or anything that we don't want to see. After that's done, I put a nice neck garment around there to gently provide some compression in the areas that we worked and to make sure everything sticks down nicely. I have them wear that for anywhere from 2 days to 7 days after the procedure.
Hi there, it's Lindsey. I am day 1 post-op. I do still look kind of like an elf. They told me that I can't take this off for another 24 hours and do the whole wash and reveal. Here we are, day number 2 as promised. Just a little forewarning, I'm feeling really puffy. I realized the past couple nights I've had ramen, which as we all know, ramen is so high in sodium. After getting lipo, you're supposed to stay away from salt. So, bad girl. I'm gonna do that from now on, drink more water. But yeah, here we go. This will be a good standard. So now we can see how puffy I can get, and then in the next few days how snatched I'm going to be. But we can see right here. And it's still a little blowfish, but it'll go down eventually. It's been 2 weeks today since I had chin lipo. I'm so happy with the progress so far, and I know these aren't the final results, but just from when I started to now, it's already looking so much better. As the weeks go on, I'm hoping that the scar tissue will subside. It's just a little tight right here. The incisions are already diminishing. They're so tiny, you can't really even see them anymore. And I can't wait to see what the future holds 2 to 3 weeks from now and even 6 months from now.
Once you get the chin lipo and skin tightening, the result is actually permanent. So it's not something that you need to keep on doing after a while. It's a one and done thing that will stay with you and then just continue along the normal growth and aging process with the rest of your body.
I really didn't experience any pain. Maybe like the first night where I was still kind of like just sore and groggy from surgery itself, but I really didn't need any of the pain medication. They recommend getting lymphatic drainage massage, so I have a masseuse that I've been going to for a while. When I see her, we do 45 minutes of a massage. She works out any of the like stiffness and the swelling, and then I continue that at home as well.
I think the key after this procedure is really to just take it easy a little bit, don't go nuts, but it's equally important to not lay there perfectly still and just don't do anything. Live your life, be comfortable, just follow your instructions and you'll do great.
Working with Dr. Gabe was great. He has a good bedside manner, he's funny, and he's really experienced.
Lindsey's amazing. She is someone who's she's funny, she's so smart, and she knows what she's getting into. That for me was one of the best things. She did her research. She is a fantastic patient. When
I look in the mirror now, it's amazing because I can actually see my jawline come out and more pronounced, and it reminds me of how I used to look when I was younger. I feel so much more confident, so much more myself, my best self, but it definitely has made a big change in my confidence. It's something that I, don't have to think twice about now, and I can really just like go out and conquer the world. Thank you for watching Refinery29. To watch more videos, click here. To subscribe, click here.